National Council Licensure Examination, simply known as NCLEX, is an international license exam for the nurses in United States of America. This exam is administered by the NCLEX, which is the National Council of State Boards of Nursing, or NCSBN. The exam is taken by candidates who have graduated from a school of nursing and want to get a nursing license. The registering fees for NCLEX is within the range of $200 to $400 depending on country to country. Hi, I'm Siddhartha Siri and this is Youth for Work, and today we'll talk about NCLEX. Now discuss the eligibility and application process for NCLEX exam. The candidate applying for NCLEX exam must be a nursing school graduate. As the exam is conducted in only two languages, which are English and French, a candidate must be fluent in one of these languages. You must have an authorization to take test or an ATT letter from your state board of nursing, which will assure you that you have necessary skills to get a nursing license. There are no age criteria for NCLES, but the candidate can only apply after passing from a school of nursing. If you are eligible for NCLEX, proceed to register for the exam. A candidate can attempt NCLEX only 8 times a year, with a gap of 45 days between each attempt. Discuss the exam pattern for NCLEX exam. NCLEX is a computerized adaptive testing format exam which evaluates each candidate by the ability to think critically about decisions involving nursing care. The exam has two levels, which are NCLEX RN and NCLEX PN. NCLEX RN or NCLEX Registered Nurse is an exam which a candidate must clear to get a license as a registered nurse. The NCLEX RN uses the 5 setup nursing process, which are assessment, diagnosis, planning, implementation and evaluation. Other level is NCLEX PN or NCLEX Practical Nursing, which is required for license as a licensed practical nurse or licensed vocational nurse. Both levels focus on 4 areas of practice, which are safe, effective care, environment, health promotion and maintenance, psychological integrity and psychological integrity. The exam is divided into 3 levels and approximately 90% of questions are multiple choice. A few tips and tricks to take this exam. As there are only 2 languages in which you can give the exam, choose the language in which you are most proficient or comfortable. Candidates must have knowledge of medical terms. As this is a nursing exam, there will be a lot of questions related to patient care, so keep your focus on the patient. Think of the ideas which will be least suited for the situations. Read all questions carefully and do not assume something out of question. Lastly, take as many mock tests as possible. For this, I would recommend the application developed by Youth for Work, which is known as Prep Guru.